Good morning, ladies and gentlemen. My name is Mulugeta Bayisa. I am Ethiopian who teaches physiotherapy in University of Gondar, College of Medicine and Health Science. I have been teaching in University of Gondar, College of Medicine and Health Science, Department of Physiotherapy since September 2008. At the moment, I am studying postgraduate clinical physiotherapy in University of Gondar, College of Medicine and Health Science. I'd like to start my speech thanking most sincerely Research4Life and its partner HINARI for inviting me to present my story on their 10th anniversary. So thank you, HINARI. Today we are living in very dynamic world. Some of us walk and the others run to catch up with the world. We all run for quality in healthcare, answering patients' questions, narrowing knowledge and skill gap of health professionals in both developed and developing countries. Improving global health is clearly one of the major human challenges of the 21st century. Healthcare resources are limited, especially in low-income countries, and so there is a pressing need to make the best use of the resources we have at hand. There is a fast-growing need of up-to-date research to challenge most of the health problems in Africa. Now the big question is, how can we satisfy these growing needs for biomedical research? The answer is easy. Either we have to do research on our own or access what's done by others. HINARI is the best site to access research done elsewhere in the world. Sir Liam Donaldson, writing in Quality in Healthcare in 2001, said, Healthcare in the 21st century will require a new kind of health professional, someone who is equipped to exceed the traditional doctor-patient relationship, to reach a new level of partnership with patients, someone who can lead, manage and work effectively in a team and organizational environment, someone who can practice safe, high-quality care but also constantly see and create the opportunities for improvement. I am going to focus my presentation on the impact HINARI has made in my clinical practice in the last 11 months. Before I present my story on how HINARI has brought change in my clinical practice, I'll take your mind 7 years back to University of Gondar. When I first came to University of Gondar as student of undergraduate physiotherapy program, we were highly reliable on books, which were few in number and also all from 1980s and 1990s. These books didn't include the current scientific research and evidence of dynamic and ever-growing science of physiotherapy practice. HINARI is a site of no option to use to satisfy health needs of the community in low-income countries with inadequately trained health professionals. When I became staff in my department, September 2008, there was a growing need of clinical evidences. However, it was not that easy to present currently available research evidences to students and patients about the effect of physiotherapy treatment modalities, mainly for two reasons. The first and most important is the lack of evidence-based practice culture in our clinical setup and institution as a whole, and secondly, because of the lack of resources such as up-to-date books and limited access to internet in our university. Until September 2010, the time I started my clinical postgraduate program, I couldn't answer clinical questions such as why, how, and what, which are crucial in educated clinical practice. My clinical judgment was not patient-centered and wise at all. September 2010 has become a turning point of my way of thinking, a great paradigm shift from a passive mind that accepts everything as written or in books or told by seniors to an active mind that questions everything said or written in books. But now, thanks to HINARI, I started making a difference by saying, this is the right clinical practice. I am able to make a true observable difference between the past and now. A man speaking on behalf of people living with disability said, if you ask someone what their favorite therapy is, they will tell you the one that works. From the above saying, what I understand is, using intervention that works is what evidence-based practice is all about, and this can be obtained mainly from HINARI side. An evidence-based practice came from an integrated integration of best research evidences, clinical expertise, and patient values. Using HINARI, Joanna Griffin, VSO volunteer, and I made therapeutic exercise program for adults living with HIV and AIDS, which is now helping people living with HIV and AIDS to improve their health-related quality of life. The therapeutic exercise program is a new program for adults living with HIV and AIDS that is available only in our department since we started using HINARI website. I also wrote literature evidence in the use of spinal manipulative therapy for acute low back pain and physiotherapy management guidelines for children with obstetric brachial palsy. Our institution before HINARI. Our department used to rely on very old books and discuss with colleagues to solve patients' problems. We used to practice a traditional way of patient care. We decided for the patients. We didn't include patients in decision-making process. It was very difficult for our institution to narrow the gap between what is practiced now internationally and what we used to practice, which was unable to answer our patients' problems at large. I came to know more about HINARI after 3 tutors, 2 from UK, Leicester and Oxford University, and 1 staff from Jimma University, Ethiopia, came to Gondar University to introduce about evidence-based practice and health information through Leicester Gondar links since September 2010. On HINARI site, I was able to access different original research articles, clinical trials, reviews, both primary and secondary researches directly from HINARI or different sites such as Cochrane Review, PubMed, CINHAL, and ATC through HINARI site. Before I became familiar with HINARI, Google website was the only source of medical information for me to get some research. These informations have been vague and sometimes was not related to the information I was looking at. Besides this, it was not also easy to get very up-to-date and new researches free on this site. However, ever since I started using HINARI, I am able to access up-to-date free researches that is benefiting my patients. Since we started using HINARI, we have developed a culture of paper appraisal on different researches with my colleagues, which helped us to write treatment protocols and guidelines that can hugely bring a difference in the quality of life for our patients. Because of HINARI, I am now able to find answers for different questions about physiotherapy and treatment modalities used. This could largely improve the health of our individual clients or patients and community at large. The biggest benefit is also for our students. Keeping students with new concept of patient care will improve the quality of physiotherapy patient care, as these students will graduate and cover different hospitals in Ethiopia. Since I started using HINARI, every time I see my patients or read different patient care scenarios, WH questions click into my mind, which make me start thinking and asking the following questions. Who my clients or patients are, what type of treatment I am considering for them, how my intervention is compared to the effect of other interventions, what is that other intervention, where can I find articles which can either support or disagree with the hypothesis of my patient assessment and treatment, what evidence is available on HINARI, what are the goals of my therapy, how can I prove my intervention has brought change for my patients. So HINARI can answer all these questions. My future with HINARI. HINARI has opened my mind's gate and vision. In our world of full competition, I will move forward with HINARI to improve and maintain my professional competence. HINARI is going to be my professional lifeline, a gateway to up-to-date research and clinical practice. Using HINARI encouraged me to do more article reviews and look for evidences and make a baseline for my future research career too. I believe this site will make my work easier to do more physiotherapy research in the future and contribute to the world. More research in health profession will at least narrow the gap of patient care between the developed and developing countries and help poorer countries like Ethiopia to achieve Millennium Development Goals. Last, as I don't stop eating my breakfast before going to work, well, we all do, I will not stop looking for evidence of physiotherapy management on HINARI for my students and mainly for my patients, which I value most. In conclusion, I like to say that HINARI is a site which helps professionals in developing countries like Ethiopia to move forward and improve patient care. From my side, this is all. Thank you very much for your attention. Thank you, HINARI, for inviting me. Thank you very much.